Hello, I'm Dr. Deepa Maka, a double board certified physician at CosMedic LaserMD here in Ann Arbor, Michigan. This is our cosmetic Q&A. This question comes from a woman who asked me, I have a wedding in 2 weeks and I bruise if someone looks at me wrong. Last time I had injections near my eyes, I had a green and yellow bruise for 10 days that no concealer could cover. I also take fish oil and a baby aspirin daily. What do you actually do during the injection to limit bruising? And how far ahead of an event should I really book? I take bruising seriously, especially if you have a wedding on the calendar or a special event. What you can do and what I do. Bruising happens when the needle nicks one of the tiny blood vessels under your skin. Some of that is luck, but a lot of it we can stack in your favor. Your fish oil and daily aspirin are both blood thinners. If your physician says it's safe to pause them, stop about a week beforehand. It makes a real difference. I never want you to stop a medically necessary aspirin without clearance. So please ask your doctor first. Alcohol, high dose, vitamin E, and certain anti-inflammatories thin the blood too. So I have patients ease off those for a few days. On my side, technique does the heavy lifting. I use very fine needles. I inject slowly and deliberately. I use cannula when I can. Around the eyes where your worst bruise happens, I often use a blunt tipped cannula instead of a sharp needle, which glides past vessels rather than piercing them. I also ice the area before and after to constrict the blood vessels, and I also use a vein finder. Good lighting helps me see and avoid the large surface veins. Finally, 2 weeks is workable, but I would never cut it closer than that for someone who bruises easily. If a bruise does appear, it needs that full window to fade and for makeup to cover cleanly. The ideal is to treat 2 to 3 weeks before any event you will be photographed at. So for your wedding, we are right at the edge, but still inside it. Book towards the early end of your remaining window. Follow the blood thinner guidance, and we give ourselves every advantage when we do this. Again, I'm Dr. Deepa Maka at CosMedic LaserMD in Ann Arbor, Michigan.